with Donna Friesen.
Good evening and thanks for joining us. We begin tonight with an exclusive look at a Health Canada program some patients say has been taken over by greed. It involves the medical use of marijuana. It's legal in Canada, but patients need a doctor's signature in order to get it. Finding a willing doctor isn't always easy, and a Global News investigation has revealed some patients have resorted to paying hundreds of dollars to get the approval they need. Our health specialist, Jennifer Tryon, has our top story tonight.
Marie Cole says she got blindsided trying to access Health Canada's medical marijuana program.
I felt like I was a part of a scam or something, honestly.
She has MS, and all of her doctors refused to sign the government paperwork for a legal marijuana license. She had hope when she heard of this doctor, Dr. Ira Price, a doctor she says is known for being sympathetic to cannabis as medication.
I'm like, okay, finally, I'm not going to have to worry about having to get arrested, maybe.
She got an appointment, showed up, right time, right place, and ended up here, not at a doctor's office at all, but at a law firm.
As I was sitting down, he said, okay, I need the $1,000. And I'm like, $1,000 for what? What are you doing? Seriously, I can fill out the paperwork myself.
We asked the lawyer, Ron Marzell, at this law firm to explain why he's intervening in these medical appointments and why patients are being charged for a program that's supposed to be free and accessible.
I will help people who want to be helped. There's a market for it. There's no question that there's a market for it.
A big market. Global News has learned so few doctors are willing to help patients get legal access to Health Canada's program that this lawyer has developed a network of doctors willing to sign for cash. He does the paperwork, and they all make money.
It's a little deceptive, though, for someone to be calling a doctor's office and to be given an address, and they show up here.
Okay.
You don't see that?
Again, I don't know where the confusion was with this particular patient.
We caught up with Dr. Ira Price, who's signing these forms.
Hi, Dr. Price.
How are you?
We need to ask you about why you're charging hundreds of dollars to sign off.
I don't charge hundreds of dollars.
But when our producer went in, posing as another patient, sure enough, he was charged. This time, $339.
Thank you. No problem.
We discovered the clinic is used exclusively to sign off on patient after patient, paying for access to Health Canada's medical marijuana program.
Perfect.
I don't have any financial motivation in the clinic whatsoever. I'm assuming it's a free market. If they want to charge a certain amount and a patient is willing to pay for it, or a client, it doesn't have to do with me.
But do you know that's going on?
I'm not familiar. I will have to familiarize myself with it.
Both the lawyer and the doctor said the Health Canada program is confusing for patients, and it's riddled with bureaucracy, and they are helping patients navigate it.
Is there anything wrong with a doctor wanting to make money?
On the back of some of the most vulnerable patients.
Absolutely, and it shouldn't have to be that way. We need a better program.
The government is promising one, but their spokesperson was completely unaware of what patients are faced with.
What you're telling me, I'm totally unaware of. We need to make a change. So what Health Canada is going to be doing over the next 18 to 24 months, we're going to be phasing in a new program.
A new program in the future, while patients trying to access the old one now say they're being taken advantage of at every turn.
And Jennifer joins me now. Jen, this is the last thing these patients need when they're in pain. What else have you uncovered about how widespread this problem is?
Well, it's far beyond just this isolated case, Donna. We discovered there are actually roving clinics where doctors see patients in hotels, patient after patient showing up willing to pay access for the program. Some are that desperate. Others are showing up with an ulterior motive. We know of some drug dealers with grow ops, all perfectly legal because of their medical marijuana license.
And Jen, help us understand why there are so few doctors willing to sign off on medical marijuana use.
Well, for one, it's marijuana and it's illegal, so right away that puts many doctors off. Others that might be open to it have no guidelines. They don't know how much to prescribe or what to use it for. So those two together, many just say, I'm not doing it.
All right, Jen Tryon, thanks for your reporting on this. And tomorrow, Jen has part 2 of her investigation into medical marijuana use and how it's being exploited by drug dealers who are managing to make huge profits off what is a program designed to help sick and dying Canadians manage their pain.